Okay. Facebook land, it is Bill Paravano, the knee pain guru. Facebook is building an audience for me. How nice of them. We have, in a little bit, we're going to get into a question here from a Teresa. Lives in North Carolina. She injured her knee last summer. Had surgery. Got everything taken care of by the conventional medical model, what they were able to help her with, and she's still having issues, which is a common thing. People go to doctors and they don't always feel better when they come back from doctors, which it's an important distinction to understand where the doctor's role is and then where the doctor's role is not. So it's important to understand where that line is, because it's a very fine line. Of course, ultimately the body heals itself. That's what does the healing. The doctors do not do that. So when you're speaking with a doctor, it's important to know that they're human. And just because they have letters after their name does not necessarily mean that they are the be-all, end-all as far as decisions for what's going on with your body. You are empowered with that choice and understanding of what happens to your body, whether to have surgery or not have surgery, whether to have a shot in your knee or not have a shot in your knee of whatever they're going to put in there, whether to have prescription drugs you put in your body or not. So ultimately, you are empowered with those decisions, and any doctor that is telling you otherwise, find another doctor, because they are not the person that I personally would feel comfortable with. You really have to feel comfortable with the person that you're dealing with. So, with that being said, I'm going to read Teresa's situation. Teresa's a nurse, and it's interesting. This is the third nurse that I've had either questions for or spoken questions from or spoken with this week. So Teresa writes, "Hello, I injured my knee June 12th last year. They told me it was most likely an MCL sprain and I can take 6 to 8 weeks to heal. So waited and followed instructions. Finally had the MRI, which showed a meniscus tear. Saw the surgeon, who didn't even touch the knee literally. He just said, I can fix you. So I'm great. So she said, great, let's get that done. We'll had surgery on October 3rd, so this was in the fall. No change in range of motion, it actually got worse. So does the whole, did the whole PT thing. PT finally says there's nothing I could do for you. Secondary though, your kneecap adhered to scar tissue, arthrofibrosis. So, she asked the PT, what do we do next? The answer, see the surgeon. So the surgeon tells me just to sit with legs straight, elevated on a chair, with 2 bags, which food on each side, so I could get extension back. Still not working. Get the extension boards, that for every hour for minutes until HS. I see no change in extension. My calf muscle was constantly flexing. Obviously, the knee hurts. I stopped using the board and attempting to do some of the things you showed me on the videos to break up the scar tissue. It seemed to help some. My kneecap does move slightly now. Still, flexion contracture is obvious. My knee is bent. I call it stuck on stupid. I really need help, and I don't like taking pain meds, but the pain is excruciating at times, so I take the Norco 5 when needed. They do not relieve the pain, but that's okay because I can suck it up. I see your videos today and see you live in North Carolina. After all that above, trying to explain everything, do you actually see patients? And if so, how can I see you? I'm a nurse, so I do understand the anatomy part somewhat of the knee, but I'm not an expert. So if you could help me, that would be awesome. Thanks." Okay, Teresa. Yes, I see clients, but it depends on which level of my program is the best fit for you. The best thing would be for us to talk. And that is something we can address again here in a little bit. The reason why the range of motion got more difficult after the surgery, and this is a really interesting part, is what the surgery does not address is how our nervous system responds to a threat. So when we have an injury, it's a trauma, it's a pain. The body tenses up to protect itself. Normal, natural response to that type of input to our nervous system. When the meniscus was torn and then you went to the doctor to hear, that they were going to perform surgery, and you have the surgery is another trauma to the body. The body tightens and tenses up because of the fear of what's going to happen on the other side of the surgery. So you now have had the initial injury, one trauma to the body. You have the surgery, which is an additional trauma. Now, that's not to say that the surgery was a bad thing, because something mechanically torn in the knee is an issue that probably needed to be addressed. So I'm glad you got it addressed, but what happens is that additional trauma causes the body to tense up to protect itself even more. And when it tenses up to protect itself even more, what ends up happening is the joint gets tighter, closer together. When the joint is tighter and closer together, it's protecting itself more. The knee is a hinge joint. So you can imagine if, building a house and you have someone that hangs a door, meaning they put the door into the door jamb and they have the hinge that's supposed to open and close the door, hold the door in place. And if they don't line the hinge up right and the door binds on itself, the door won't close all the way. This is the same thing as happening in your knee. There is an angle, a part of the hinge that's going on in your knee joint that doesn't have enough room to articulate like it needs to. And as a result, it irritates the nerves more, causes more pain, and it makes it very difficult to flex the knee, to extend the knee. Whatever you want to do, that range of motion is inhibited. Scar tissue can be an issue. However, what's more likely that's going on is it's a function of your nervous system tensing up to protect itself. So this is all, it's very straightforward, and I'm glad that the medical model doesn't understand what I do, and I'd be happy to help you. So I go up, I believe above here, this will be on the Facebook page, the Knee Pain Guru Facebook page, and click on the link to set up a time for an appointment. And I'll be happy to talk with you and explain to you how my program works, and what we would do specifically for your situation, which is, get the knee comfortable first, get you out of pain, set up the conditions so your body can reduce the inflammation in your knee as well as in the rest of your body, and then make sure your mindset's in a good place. So when we have, whether it's a good day or a bad day, good day, make sure you don't sabotage yourself and throw yourself back into pain again. And on the bad days, we go back to the basics, which is getting the knee comfortable, reducing the inflammation to shorten the duration of the bad day. So, Teresa, that's what I have to offer for you. If whoever's watching this, the replay of this, and they like to connect with me, I'm on Facebook, I'm on YouTube, I'm on Twitter. You can go to my website, thekneepainguru.com. I got an assessment you can take. There's all sorts of resources available to help you understand better what's going on with your knee, as well as get you a solution that doesn't involve drug shots or surgery. If you have a question, you want to ask it below this video, type it in there, and I will answer these questions on future live streams like this about what's going on with your knees. So I'm Bill Paravano, the Knee Pain Guru, going to sign off for today. Have a wonderful day. Make it a good one.